Hello and a warm welcome back to our Facebook Live on treating long haul COVID. Now, as many of you may know, we are in the middle of a kind of secondary pandemic, as it were, where we know that around 5 to 10% of patients who contract COVID-19, even mildly or severely, go on to developing long-term symptoms for many months. And in some cases, given that COVID started last March in the UK and the US, people have had long-term symptoms for 6 months, 9 months, over a year now. And it's really as a secondary pandemic that is so important for all of us to address. So in our last Facebook Live, just a couple of minutes ago, we spoke to a couple of our, I suppose, ex-patients, we'd call them now, who've reached 100% recovery using the Gupta program. And here we're just going to answer any questions that you may have about long-haul COVID and what potentially is our hypothesis as to what causes it and how we treat it. So I'd love for you to once again share this with anybody who you know who's got long-haul COVID, who's experiencing those symptoms, and let's see how many people that we can help with that. So just to give you a bit of background, we believe that long-haul COVID is essentially what we term a neuroimmune conditioned syndrome, or NICS. Neuro because it involves the nervous system, immune because it obviously involves the immune system and an over-inflammatory response, conditioned because we believe it's a conditioned response in the brain, an overreaction in the brain, and syndrome because each type of patient has a unique cluster of symptoms, we believe, according to their genetic or physiological vulnerabilities, which is why no two long-haul patients seem to be the same. And obviously researchers are trying to understand what consistent data they can find in terms of symptomatology or measurable changes in the body. And the way that we think long-haul COVID starts, it's very similar to other conditions we treat, like fibromyalgia, ME and chronic fatigue syndrome, mold illness, and various other connected syndromes like MCAS, mass cell activation syndrome. So we believe that when someone experiences COVID-19, it may be that there could have been some vulnerability in the system. There may have been some physical, mental, or emotional weakness, which meant the immune system perhaps had to work harder to fight off the virus, but not in all cases. And then if somebody goes back to work too quickly or perhaps goes back into a normal life, the combination of those two things creates a conditioning event in the brain, specifically in two structures, we believe, the amygdala and the insula. And those two brain structures, essentially, even once COVID-19 has disappeared from the body, or at least the person doesn't test positive for COVID-19 any longer, it's left a legacy in the brain where the brain believes that we are still in danger. And therefore, it over-triggers the sympathetic nervous system and also triggers the immune system unnecessarily. And even in the case of COVID-19, when people are suffering from it quite acutely, we know that a lot of that is due to the what we call a cytokine storm, where there's an over-inflammation of the lungs. So people aren't necessarily dying from the virus itself, but the over-response of the inflammatory system in attempting to defend against the virus. And that is where the cytokine storm comes in, and many people passing away from that or suffering from long-term damage in the lungs. Yeah. And so that over-response of the nervous system and the immune system, even once COVID-19 has gone, means that it keeps the body in this altered state where we have lots of symptoms. So that continues the symptoms of post-exertional malaise, where people can't do too many activities or exercise without feeling much worse for days afterwards. There's headaches, breathlessness, fatigue, and exhaustion. Yeah, there can be a lot of gastro challenges that people face with these conditions, and even pain, and a whole host of other symptoms that are unique to each patient. Sometimes there's excessive coughing. And so once those symptoms occur in the body, we believe that the brain erroneously still believes that those symptoms are what we call conditioned triggers, or are evidence that we are still in a COVID-19 virus response. And therefore the brain, in its hypervigilant, hypersensitized state, magnifies the signals coming into the brain. The brain on that hyperalert system, once again, over triggers the nervous system and immune system, triggering the very symptoms that it is hypersensitive to, creating the vicious cycle. And as our guest said, the loop in the brain. The loop in the brain, essentially, the brain responding to the body responding to the brain. That is the vicious cycle that then gets set up. And we know that in many different conditions, sometimes the brain can make mistakes. We perceive it as mistakes. It's actually the brain, from an evolutionary perspective, prioritizing survival and erring on the side of caution. Because the brain says survival is more important than you feeling healthy. Survival is the number one protective response to ensure the passing on of our genes to the next generation. And that's what we believe sets up this vicious cycle for COVID-19, or rather long haul symptoms continuing for many months. And that hypothesis has been published in 2002 in the journal Medical Hypotheses. You can read that on our website. And as some of you may know, we've just recently published a randomized controlled trial. We believe it's the first randomized controlled trial on a neuroplasticity brain retraining program in the world. And it was on fibromyalgia patients. And this was published in the Journal of Clinical Medicine. And it showed that just after an 8-week intervention, there was a 0 effect on the control group, but a 40% drop in fibromyalgia scores, or close to a 40% drop in fibro scores in the active group taking the Gupta program. And there was a halving of anxiety and depression, a halving of pain, and a 50% increase in functional capacity. Okay, so that's a study that you can read also on our website, and we are currently engaged in a further long haul study, a randomized controlled trial, to show the effects of this program for long haul COVID compared to a control. Great, so let's go to your questions. So please put your questions in the comments box, and please do once again share this video with other people that you know are suffering from long haul COVID, anyone that you think could benefit. Lara asks, is there a difference between long haul COVID and CFS ME? You know, at the moment, it's too early to tell. There may be some unique aspects to long haul COVID which differentiates it from ME and chronic fatigue syndrome and fibromyalgia. Too early to say. I think there's a lot of research that's occurring right now. Our feeling right now in terms of the patients that we're seeing is that there are many similarities, and the course of the infection, the course of recovery seems very similar to our patients with ME and CFS. And remember, there is a precedent for this. So if we look at, for instance, glandular fever, which is also known as mono or Epstein-Barr, those particular conditions, we know that around 10 to 15% of patients who contract Epstein-Barr go on to having longer symptoms. But we've definitely noticed that the symptoms in long haul COVID seem to be more severe than those in glandular. That's just an anecdotal observation. Michelle asks, can it work for long COVID POTS-like symptoms? So POTS stands for postural orthostatic tachycardia syndrome, and many of the symptoms include dizziness, difficulty standing for long periods of time. And certainly POTS is something that we treat at our clinic, and we've had many people who've been able to use our program to overcome that. It's interesting that you talk about POTS in addition to long COVID, because once again, the core reason for these conditions we believe is very similar, which is this overstimulation. And whether someone gets POTS or not, whether someone gets gastro symptoms or not, once again, is down to those unique genetic and physiological vulnerabilities for each patient. Natasha asks, is the program for long COVID the same as the one I purchased several years ago for chronic fatigue? Okay, so the program was completely revamped in 2019, Natasha. And if you already have our old program, you can upgrade to the new program for a very small amount. So please email our clinic, and we'd love for you to experience our new program, which we think is far more comprehensive and easier to use than the old one. Susan asks, what protocol have you been following in the clinic to enable healing? So we've been following the protocol that we've been using at clinic for many, many years, which is what we call the 3 R's of the program. The core R of the program is retraining the brain. That is the specialist neuroplasticity brain retraining techniques. They're not psychological techniques, as we said, they're brain rehabilitation techniques. And they involve teaching a patient to recognize those danger signals that are on the periphery of consciousness, that are normally in the unconscious part of the brain. But there are safety valves that we can access. So being able to recognize that and using specialist techniques, repetitive techniques, are able to retrain those processes. And there's several brain retraining techniques that we use. And there are 2 other R's to the program, which are supporting techniques. The first one being relaxation of the nervous system. And that's where the meditation, the breathing, the lifestyle changes come into effect. And the third R is what we call re-engaging with joy. And that is a very important part of healing that is often negated or ignored in mainstream medicine, which is this idea that actually understanding and having a rational hypothesis as to what's causing your condition, and also engaging in things which actively uplift your system, create the feel-good chemicals in the brain and the body, can also be very supportive of neuroplasticity and also healing as well. And it reminds me of the film Patch Adams, who had great success in healing people just through the power of laughter and joy. Okay? But as I said, those are just supporting techniques to the main core aspects of the program, which is the brain retraining. Wendy asks, are the results good with chronic Lyme? At the moment, we are having good results with Lyme, and many of our patients do have Lyme as a diagnosis and the Borrelia infection. We haven't done any systematic studies on Lyme. And once again, if there are any researchers out there who'd like to conduct studies, we believe we could get a good result with chronic Lyme. So we'd love to do a randomized controlled trial of that. Hello Oz is asking, I'm doing the trial. I think psychologically the cost makes me distrustful somehow. Why is it not an NHS program, etc.? Hello Oz, thank you for your comment, and we'll answer it absolutely directly. At the moment, we have approached many people in the NHS, and rightfully so, as part of the NICE guidelines, there needs to be independent randomized controlled trials before the NHS or other insurance companies will take on this type of treatment. And that's totally understandable, which is why, Helwaz, you're on the trial, and that's why we're doing the trial, is to have it independently tested. And if it shows that people do better on the program than they do in the control group, then that's perhaps something that then in the future the NHS may look at. And in terms of the cost, so at the moment with the discount, the cost is $300. Now, for us, that is the minimum amount that we felt we could charge in order to just be able to run a clinic. So as you can imagine, there are 15 interactive videos, there are 20 audio exercises, there's a clinic and support staff that we have to run, there are many coaches, there's the online system, there's all the IT behind that. So for us, $300, which is around £210, was the minimum that we could charge just to be able to run the clinic, employ people, and move forward. So we hope that it's not prohibitive. And as we've said, that is something that comes with a 1-year money-back guarantee. So you can try the program. If it's something that doesn't work for you, you can return it, get your money back, and use it for something else. So we hope that we've priced it as reasonably as possible. Lily asks, I've had long COVID for over 4 months now. I'm doing a graded exercise program that I think is helping. Does the Gupta program work with this, or would you recommend taking it easier? Lily, if something is helping you, we're very pragmatic. So we want you to do whatever works for you. We work slightly differently in terms of a graded exercise. So we work more with pacing. So we believe that pacing in a graded, is far more important, because you will have good days and bad days. Now, a graded exercise program generally tends to have a methodical process of how much you increase your exercise each day. Whereas we find if someone's had a dip or a relapse or things have come back, then it's important to pace and pull back on that activity until you feel better. But certainly our program doesn't necessarily mean you can't continue with your graded exercise program if that is helping you. So you could work in parallel. Hello, I was asking, this is not recommended for sufferers of ME, etc. Well, actually, that's where we started. The program started with treating ME and chronic fatigue syndrome. And we have published a clinical audit of our patients, which showed that 2/3 of our patients with ME and chronic fatigue syndrome reached a 80 to 100% recovery within 1 year. And you can read that published research on our site. Now, that wasn't a randomized controlled trial, but it certainly showed a positive result. So this is something that I suffered from myself. So I suffered from ME and chronic fatigue syndrome many years ago. I managed to get myself better, and then I set up this program to support other people's healing. So that's really what we started, and so we do recommend the program for ME. Maria asks, a lot of long haulers have dips in blood oxygen levels. Do you think that this is also caused by an overactive brain or the actual condition? Yes, we know that definitely in long haul for some patients, there are still some physiological, purely what we call organic or purely physiological, I suppose, residues in the body. So that could be scarring in the lungs, etc. Now, we encourage everybody before they come onto the Gupta program to get everything checked out by your doctor, by the mainstream medical profession, to disclude any other potential causes of your condition. And I know many people who've had it, if you've had it for months, obviously you would have done that. So that's very, very important. Now, could blood oxygen levels change as a result of an overactive brain? It's difficult to say. So I don't think we have any evidence either way, but further research is occurring. And a similar question in terms of, from Sophie, shortness of breath in long COVID. Is this caused by a loop in the brain and not the residual inflammation? I believe it's probably both. The chances are it's both, because we know that when people are in a highly sympathetic state, it's the wrong word, isn't it, sympathetic, but it's the stress state, we know there can be a shortness of breath, even if in people who don't have long COVID. And we've seen this in ME and chronic fatigue syndrome as well. Now, you may say, well, hang on, if this is something physiological, surely that's not going to go away. By doing the Gupta program, what we believe is you're bringing your body and your brain into what we call the optimal healing state. Now, our bodies are often our own best healers, and even many medicines that people take, even the vaccines that people are taking, they in and of themselves don't cure the body. They enable the body to cure itself. A vaccine triggers a defensive response that then is able to recognize infections in the future, or the virus in the future. So by taking the Gupta program, we're enabling that body to go into a parasympathetic state, the rest, heal, and digest state, where the body focuses less on defensive mode, but more on healing mode. And so we would hope that by being in that state, perhaps any residual inflammation in the lungs or scarring, certainly the healing would be better than if we're in a sympathetic state. Okay, so even though many people have shortness of breath, I think we would still recommend that you take the Gupta program in parallel to getting it checked out at a physiological level. Johanna says, is it dangerous to try exercise whilst having long haul COVID? I feel good whilst working out, but only to have it backfire on me the day after. Being too sedentary can't be good either. Johanna, yes, we would definitely recommend not exercising whilst you have long haul COVID if you're having what is called post-exertional malaise, where a day after or even immediately you feel much worse. It doesn't benefit you, I believe. I think it only reinforces those defensive systems. So imagine the defensive systems are thinking, is the COVID-19 infection still here? Then you go and work out, which causes an already exhausted body to push itself beyond its limits. And the brain then interprets that heightened level of symptoms as further evidence that we're still in danger and we need to be protected. And therefore, I would recommend not exercising. At the same time, I agree with you that perhaps being too sedentary can't be good either. And that's why we recommend the pacing, which is initially someone, perhaps if they're bedbound, could only manage some very gentle stretches. But as one feels better, Perhaps someone walks for 50 meters, 100 meters, 10 meters, and then gradually builds up that exercise in a paced way. So it's better to be sedentary than engaging in exercise that then backfires on you. Kristen asks, how long does it take to work through the program? Can you go through it at your own pace? Yes, Kristen. So people go through it in their own time, in their own space. Some people consume the videos within a week. Some people spend many weeks going through the content, practicing the tools and techniques. So definitely there's no pressure to rush through it. David asks, what's the difference between your program compared to other similar programs? Yeah, so we were the first neuroplasticity program that existed in terms of an online program, video program. We first published in 2007, and since then there have been other programs that have come out. And if you've made progress on another program, great, David, that's great. You've asked, should I continue or switch? That's totally up to you. But if you feel that you've reached a plateau and you want to have something different, then I guess you could come to our program and see what extra we add. Because we believe that although you're saying they're all based on the same strategies, our program we feel is quite different to some of the other neuroplasticity programs out there. First of all, we find we're far more holistic, and we really emphasize this idea of staying well for the long term and recognizing some of the aspects of us as human beings that might encourage us to push beyond our limits, which then can cause dips and various issues. So that's something we really go deeply into in the last 5 sessions or so of the Gupta program. And yes, although there are similar strategies, we feel that what we're presenting is quite unique. Anna asks, do the meditations have to be done at a particular time each day? Anna, we do recommend certain times, but obviously you can fit it around your busy household. Amy says, do you believe there is potential brain damage from long COVID? Good question. At the moment, we don't know. What we do know is similar to ME and CFS, there is certainly excessive inflammation in the brain, especially in the amygdala, the hypothalamus, several brain structures that have been identified, the anterior cingulate. And there's also inflammation in the body as well. So is there any longer term damage from that? We would hope that there isn't, because inflammation is something which has a short-term impact. Once we reset the nervous system and immune system, we would hope that the body comes back to homeostasis and there's no longer-term damage, but I think it's too early to say. Carla asks, would this help whole body acute neuropathy pains, but with no other symptoms? Yes, certainly. Our program, as you know, we've certainly tested it with fibromyalgia patients and other types of pain syndromes where there seems to be a neurological cause. So certainly we would recommend it for conditions like that. Once again, only once you've had everything else checked out by your doctor and the mainstream medical profession. Imogen asks, I already do meditation every day, but I still have long haul symptoms. What else does the program provide? Imogen, definitely want to emphasize that our meditation and other relaxation techniques are simply supportive. The core of the program is very unique and it's about brain retraining. So certainly there's a lot more than meditation in there to add. Yes, some people talking about, sorry, I can't get to all of your questions, asking about MCAS, so mast cell activation syndrome. Yes, we do believe that, and certainly there is some new reports coming out about this, that there seems to be mast cell activation in patients with long haul. And once again, is that the cause or yet another downstream intermediary effect? We believe that it's an intermediary effect. So the brain is the kind of the head of the nervous system and the immune system. It makes decisions to keep us alive, it then tells those cells, those mast cells, to be triggered, and that's what then can contribute to physical symptoms. But it's not just the mast cells which are being triggered to cause the symptoms. There's many other mechanisms as well in our view. B asks, I'm not ill enough to be in bed all day, but every time I tip over a certain amount of activity and work, e.g. a couple of hours of desk work, 4-kilometer walk and some stuff around the house, I get more fatigue, palpitations, tight chest, etc. But I find it difficult not to plan and keep doing stuff as I live alone and I'm self-employed. Can I do the program in a beneficial enough way alongside trying to keep my life going? Yes, we're very practical here at the Gupta Program. So we know that some people have help and support, others don't. So we try to make the program as easy as possible to follow and for it to integrate into your life. I certainly would say, as I made a comment earlier, that the more you can reduce your overall levels of exhaustion, or exercise that then lead on to exhaustion, the better. You don't want to be regularly overdoing it. Yeah? If your symptoms get worse as a result of exertion, please pull back on the exertion so that it's more level in terms of your symptoms. Krista asks, have you worked with children and do you have any data showing long haulers have recovered from your program? So Krista, on the first point, in terms of children, we have had some people who've used the program with their children by learning it themselves first and also interpreting tools and techniques for children. And secondly, in terms of long haulers, have we got any data? At the moment, we are tracking that. So we're tracking how many people we have. So we certainly probably treating around 100 long haulers, and we've certainly had about 10 or 20 people who've already come forward and shared their stories. But that's the purpose of our trial, so that we can actually have independent data on the impact and how people recover compared to a control. Ilona says, I'm a huge fan of the program and I'm doing it now. Thanks so much. But I wonder, could it help someone in their 80s with neuroinflammation, with an infection like COVID, with strong anxiety and depression as a result? You know, Ilona, it's amazing. I'm always incredibly surprised and grateful when we hear of people in their later years, shall we say, who are able to put the program into practice and recover. And many of you who've on our webinar series, in our first webinar yesterday of this series, we had a lady in her 70s, who'd had fibromyalgia for 30 years, who was able to share her story and say, yeah, after 30 years of having fibromyalgia, she was able to heal, recover, and rather than someone think, oh, I've lost that 30 years, she was so enthusiastic to say, and now I've still got my life ahead of me. There's still so many things I want to do in life. And I personally was so inspired by that. And we've had people in their 80s who've used the program. I remember there was an 84-year-old guy from New Zealand who had ME and chronic fatigue syndrome. And he was able to heal and recover. And once again, never felt it was too late to enjoy life and get the most from it. So I would hope that if this is something where, once again, you've had it checked out by the mainstream profession, there's nothing else that they can do for you or for your the person you're referring to, I think this is something that they can certainly try. Dawn asking a question about kind of long haul COVID and the lung scarring and damage and the inflammation of the heart, etc. Absolutely, we know that certain patients have experienced that. But what's interesting is there are many patients with long haul COVID who don't have the lung damage and scarring and the inflammation. And on the flip side, there are also many people who do have lung damage and scarring and inflammation, but don't have long haul COVID. So do we see does not equal Y. So just because we have the lung damage and the scarring, it doesn't inevitably mean that we have long haul COVID. And that's a really interesting observation. So I think that, I know it's difficult when you've had that physical diagnosis, but I would just trust in the program, surrender to the program, do all the other things that you need to do in terms of seeing your doctor, but just trust that the program can get your body in the right healing state to perhaps work at a better level in terms of this, the self-healing that can occur. Okay, so people are asking similar questions about inflammation. Yeah. Once again, inflammation, we live in a what I call a pro-inflammatory society. So compared to many years ago, now in terms of pollution we're exposed to, the foods that we eat, the toxins that we experience, we know that people are a bit more inflamed continuously. And so inflammation is something where in a kind of Th2 response, we're getting different organs, different parts of the body, the muscles being inflamed. Once again, we do believe that that's a temporary process. And once the system comes back to balance, the physical body doesn't necessarily have to have long-term effects from that inflammation. It's not necessarily like an autoimmune condition. I don't know how to pronounce this. I say Unag, I'm not sure. I've signed up, apologies if I pronounced that incorrectly. I've just signed up to the program and it's excellent in terms of settling my nervous system and slowing me down to accept and heal. Thank you. And you've also talked about my myocarditis of my heart due to COVID. So we would hope that it would accelerate the healing of things like that. Okay, so Anne sharing here. I had Lyme amongst other conditions and it worked for me. The cost is extremely reasonable and the program is so much more comprehensive than at first glance. It probably saved my life. So $300 is a small price to pay for my life and a happy life at that. So thank you, Anne. Thank you for sharing. Johanna says, I've been histamine intolerant as well as sensitive to chemicals and perfume after COVID. Can this program help the body to heal these sensitivities? Johanna, it's so interesting because once again, we do treat many people with mold illness, with chemical sensitivities, multiple chemical sensitivities. And once again, the underlying system or process probably does involve, once again, mast cell activation, histamine intolerance, hypersensitivities. And so it's interesting that you've talked about COVID triggering that type of unique response, which is slightly different to what most long haul COVID patients are experiencing. So I think that validates our hypothesis that each person gets a unique package of symptoms according to their vulnerabilities. So based on what you've said there, as long as you once again get it checked out, I do believe that our program can help support, heal these sensitivities. So we've had people use it for mold and chemical sensitivities as mentioned, but also food sensitivities as well. Okay, so just finishing off, any final questions here? Sue's saying, could you tell us how many participants were in your study? Yeah, so the Journal of Clinical Medicine, where the fibromyalgia study was published, that was, I believe, 41 or 43, around 43 patients were in that particular study. So that was a pilot study, and we're looking to do larger phase 3 trials. But certainly, in terms of the power of that study, it certainly showed a very good result, a very promising result. Okay, so just finishing off, any see any questions? I know people talking about vascular issues, vessel damage, blood vessel damage done by spike proteins. You know, once again, what I'll emphasize is there are many people who have those types of symptoms, or have been shown to have that, but don't go on to having long haul COVID. And there are many people with long haul COVID who don't have the vessel damage. So it doesn't necessarily mean that that vessel damage is the core reason for the long COVID. But certainly, once again, this program is designed to put your body in the optimal healing state to deal with those things. Vinny are asking, what exactly must we buy? Okay, so we have this interactive online video program. So you go onto our website and you can sign up for the free trial, which gives you some free videos. And then there's a one-off fee, which is $300. And what that does is you get a package in the post, you get access to all the online videos and meditations, and that's for 1 year. So you get 1 year access to all of our content online. Pamela Ross, how can one deduce if their long haul symptoms at the 1 year mark are not still due to inflammation? You mentioned inflammation is supposed to be short term. Are we certain that our bodies are not still inflamed when it comes to long COVID? Pamela, let me clarify. So I either misspoke or it was misinterpreted. We do believe that in long haul COVID, there is chronic ongoing inflammation. So even after 1 year, the brain and the body are still responding as if we are in a state of infection. And so there is chronic ongoing inflammation. What I meant to say was normally in a normal situation, inflammation is supposed to be a short-term response, but it does become chronic. And we know that the amygdala and the insula, that's where we often get conditioned responses. And this has been shown in animal studies. So it's like the inflammation just never gets switched off because the brain and the body are in that survival mode. Whitney asks, once you purchase the program, how long do you have access to it for? Yes, you have a 1 year plan, which gives you access to everything online for that 1 year. And then once again, we keep if you say want to have it for longer than a year, it's just $50 for the following year. So it's $300 for the first year, so you can get access to all the content, and it's just $50 for the following year just to cover our kind of ongoing maintenance costs with the program. Pamela asks, when you say speak to your doctor, what do you recommend we ask our doctors to help us with? Well, Pamela, there's many people talking about vascular damage, inflammation in certain organs. This is something that I would really ask your doctor to get specialist response to in a hospital, to actually get the scans done on your lungs to really identify what some of the challenges are, perhaps scanning other organs in the body. Once you purchase the program, do we have free access to ask your team questions, and how do we communicate? Well, as part of the program, you get all the online access, plus you have weekly webinars with myself. And so you're able to ask me questions in the weekly webinar, and obviously our email address, info@guptaprogram.com, you can ask questions there as well. Dawn, you're asking about EDS, and doctors saying patients with EDS are more prone to becoming long haulers. And you're saying, since EDS is genetic, does the Gupta program help with that? Once again, these are risk factors. If they're saying that, that doesn't mean X equals Y. It doesn't mean you have EDS and therefore you're going to become a long hauler. So once again, we're helping with the long hauler aspect rather than the genetic aspect. We always have genetic risk factors to anything in life. but that doesn't mean that our genes are our destiny. Hello Oz asks, I hope I'm pronouncing your name correctly. Why do you think some people are recovering after having the vaccine? So, really good question. This is, once again, in some patients, this has been an observation in some patients with long haul, not everybody by any stretch of the imagination, suddenly find that they're recovering. Is it that actually by taking the vaccine, is it resetting the nervous system and the immune system again? That is an interesting observation. That would fit with our hypothesis that when the system is in this overdrive state, it gets stuck in it. But if it is reset by, once again, re-exposure to the actual virus, does that mean that the system goes back to balance? That would be our explanation of how and if of having the vaccine might be helping. Good. Well, thank you so much for your questions. I didn't realize we'd have so many, some really interesting questions. You're really deeply thinking about this. So once again, we hope that if you are experiencing long haul COVID, or you know somebody that is, that you'll give the Gupta program a go. As I said, we're getting more and more of these different types of experiences coming through, just like we did with Kevin and George, of people recovering using the program after having it for a year and being bedbound or housebound for a year. So I hope you'll give it a go for your long haul COVID. So all you have to do is go to guptaprogram.com and see all the information there, and then you can start the program. And if you start in the next week or so, you can also still get access to our current webinar series, which only started yesterday. And you can then have those weekly webinars with myself where I support you through the program and keep up that motivation. So thank you so much for watching. I want to give you that inspiration that although there's so many horror stories and negativity around long haul COVID, we hope that we're here to help you and help you recover. So thank you so much for watching, and we'll see you next time. Thank you and goodbye.